Welcome back to Medicare in Layman's Terms. My name is Travis Dahlman. I'm a Medicare broker. Today's topic of conversation, as you can see looking over my shoulder today, is the Medicare Advantage Plan, what it is, how it can work for you, and a little bit of common misconceptions in regards to what a Medicare Advantage Plan is. Recently, I watched a video on YouTube itself where another broker who his title was essentially why I never sell Medicare Advantage policies, or why I never recommend them. I can't remember exactly what it was. But essentially, he went through the process of explaining all the negatives of a Medicare Advantage policy. Today, I'm going to do the opposite of that. I'm going to explain the positives of a Medicare Advantage plan. The reason why I'm going to do it this way is because there's so many negatives out there in the world. Let's focus on the positives. Number one being with a Medicare Advantage plan is they are going to be a little bit more financial friendly for individuals who are on a financial income restriction or on a fixed income basis. What I mean by that as financial friendly is typically the monthly premium for a Medicare Advantage plan is going to be far less than that of a Medicare supplement plan. Medicare Advantage plans range in premium based upon service area and based upon the Advantage policies in your service area. Service area typically is dictated by county and zip code. With that being said, the majority of Medicare Advantage plans out there are a $0 monthly premium. You do see those occasionally anywhere from $0 up to, I think the most expensive one I've ever seen was like $120 a month. Very rare that you ever see anything that high for a Medicare Advantage plan. Majority of them are going to be around that $0 monthly premium. That does not mean that you do not have to pay your Part B premium. You continue to pay that Medicare Part B premium. Right now the average is $170.10 a month. Everybody's is a little bit different based upon their financial situations and things like whether or not they receive extra help, Medicaid, anything like that. If you're unsure of what your Part B premium is currently that you're responsible for paying, if you have one, you can always contact Medicare and they will let you know exactly what your Part B premium is. With that being said, Medicare itself is constricted of Medicare Part A and Medicare Part B. You are required to have both Part A as well as Part B in order to be eligible for a Medicare Advantage plan. Medicare Advantage plans take your Part A, Part B, and the Advantage plans I'm going to discuss today will also take your Part D coverage, combine it all together into one policy. This is known as a Medicare Advantage Prescription Drug Plan, or MAPD. What those policies do, once again, is it's going to take your Part A, Part B, and prescription drug coverage Part D, combine it all together into one policy. So when you go to see doctors, when you go to pick up medications, instead of giving them your red, white, and blue Medicare card when you see your doctors, instead of giving your pharmacy just a standalone prescription drug card, you will give them your Medicare Advantage card. That will let the doctors know, as well as the pharmacy know, that you have coverage at the doctor's office with Medicare A and B under that Medicare Advantage plan, as well as let the pharmacy know that you have prescription drug coverage through that Medicare Advantage policy itself. Now, some caveats with the Medicare Advantage policy are with the HMO policy, which stands for Health Maintenance Organization, you do need to stay within a network of providers. Where I am located in Wisconsin. I live in an area where there's about 4 different medical groups. We have ThedaCare, Prevea, Bellin, Aurora. There's some other lesser known medical groups out there as well. The majority of them are covered under all HMO policies. So just because you have a HMO does not mean that you can't potentially go to different health maintenance organizations, different providers within different jurisdictions or different medical groups. Some HMO policies do require for you to get a referral from specialists. So if that is something that you do not like having to do, is to being able to go see a specialist, have to get a referral from your primary care physician, that is something that I would point you in the direction of either trying to find a HMO policy that does not require referrals, or going over to what's known as a PPO plan, which stands for Preferred Provider Organization. Those PPO policies typically do not require for you to get a referral, as well as they give you a little bit more flexibility and freedoms. With a PPO policy, you will have the flexibility and freedom to see providers who are contracted with the insurance carrier you have, as well as providers who take Medicare but aren't contracted with your current insurance carrier. So for an example here, you go see XYZ doctor. You have ABC Insurance Company. That XYZ doctor doesn't take ABC Insurance, but they take Medicare. You're under an HMO policy, you won't be able to see that doctor. You're under a PPO policy, you will be able to see that doctor. Even if they are out of network, you will just pay the out of network co-payment or co-insurance, whatever is affiliated with that particular provider, with your particular policy. When you go to see an out of network doctor under a PPO plan, once again, you will pay your out of network co-payment or co-insurance. Typically, it is going to be a little bit higher. There are what's known as non-differential or undifferentiated Medicare Advantage policies. Those PPO policies, it costs the same to see a doctor out of network as it does in network. In Wisconsin, we do have quite a few of those different types of PPO policies. All across the country, there's different PPO policies that do the same thing. You can always contact your Medicare broker, your Medicare providers, or whoever you currently have for your Medicare insurance. If you are currently on a Medicare Advantage plan, or if you're on a supplement and you decide you want to explore a Medicare Advantage plan, you can ask them what type of Medicare Advantage policies are available in your service area. You can also go to Medicare.gov. The link will be in the description below. You can click on that, type in your zip code, address, follow the links, or follow the link below, follow the information from that link on that web page, and it will let you know what different organizations are available in your service area. Medicare Advantage policies are not available everywhere in the country. They are available in quite a few different areas. If you ever see an ad on TV between October and December, January through March, during the annual enrollment period and open enrollment period, a lot of those ads are going to be for those Medicare Advantage policies. Once again, with a Medicare Advantage policy, you'll be receiving your Medicare benefits through that private insurance company instead of original Medicare. You still need to keep your Medicare Part A and B. You're still going to pay your Part B premium, but you're going to receive your Medicare benefits from that private insurance company. That's typically the reason why your monthly premium for that is going to be a little bit lower than what it would be compared to a Medicare supplement plan. Is because that Medicare Advantage company that you signed with and are now receiving your Medicare benefits with is responsible for assuming the risk. That risk is you, the Medicare beneficiary, if you get sick and you need to use that insurance. So your monthly premium, typically lower under a Medicare Advantage policy than that of a Medicare supplement. As well as with a Medicare Advantage policy, you get additional benefits. The one big benefit typically built right into the policy is going to be prescription drug coverage. Once again, there are Medicare Advantage policies out there that do not have built-in prescription drug coverage. For the purposes of our conversation today, I'm going to focus on those that do have built-in prescription drug coverage. As far as those additional benefits go, different Medicare Advantage policies out there do have prescription drug coverage built in, along with dental, vision, hearing, transportation. Some of them offer an over-the-counter benefit to, help alleviate your out-of-pocket costs for toiletries, vitamins, different things you'd pick up at a drugstore. Some of them offer you an over-the-counter card that, has the availability that you can use to purchase food products. There's all sorts of different additional benefits with a Medicare Advantage plan. So explore what is important to you. Is it financially, an advantage for you going with an Advantage plan? In the upcoming videos here on the Medicare Advantage plan playlist under my page, I will go through the examples of why it would save you money compared to a Medicare supplement policy to go with the Medicare Advantage plan, when I dive into exactly what the maximum out-of-pocket is under Medicare Advantage policies and how that works for you. If you do have any specific topics you would like me to cover in regards to Medicare Advantage policies or any topics in general, always feel free to use the contact information you see on the screen. Throw a comment in the comment section below. My name is Travis Dahlman, licensed Medicare broker. Thank you for watching.